So we're going to talk about neuropathy today. You can see that okay, Marcia?
Yes.
Okay, so neuropathy, we're going to talk about us, we repair, regrow, regain. That's what we do. So neuropathy, what does it mean? It means nerve damage, okay? There's no nerves there, or the nerves are damaged.
Right.
The parts of the nervous system are the brain and spinal cord. That's the central nervous system, right? And all the nerves that come off of that, anything outside the spine or the skull, is the peripheral nerves. Now, those are nerves that go to every cell in your body. All of those are peripheral nerves. And they're all connected. So actually, there's only one nervous system. Even though we divide it up, it still means that the brain and the toes are still connected. So when you look at the nerves, they have a bunch of different sizes. Actually, the nerves that come out of your back, the biggest nerves, like the sciatic nerves, they're probably in reality big about as the size of the stuff that comes out of that pen, the ink on the bottom of the pen. Those are the large fibers. Then there's smaller ones, and then there's microscopic. So we have large, small, and microscopic type of nerves. And these are one single cell. So you have to realize that the nerve that goes from your back to the tip of your toe is 30-some inches long. It's a single cell, finer than a human hair, and there's tens of thousands of them down there. Okay? So if anything goes wrong, first place those nerves are going to have trouble, tips of the toes. Okay? And in some cases it's blood. So you can have the blood that runs the nerves and the nerves that run the blood. So if you have problem with your blood, then that you don't get enough circulation to the nerves tend to die. Or if you don't have enough nerves, if the nerves die first, then you hurt the blood and the nerves tend to die. We can see this one. This is the skin, and then as you go deeper, you have muscles. You go deeper still, you can see you have nerves in there. If anything affects the blood, it's going to affect the nerves. There could be toxins, or there could be just no blood. And that's what seems to happen when you have neuropathy. So if you look at those tiny nerves, the smallest nerves, the most delicate, fragile nerves, in microscopic nerves, in the skin, any skin, you can count them, and you see how many nerves there are there. Okay? When you have neuropathy, you have less nerves, or in some cases, no nerves. Sometimes these nerves die like dry needles on a Christmas tree that just fall off. You don't even know it. That's pretty much painless. And those are the worst kind of neuropathy because they pass through the whole stage with no pain, and then one day they can't walk. Other times there can be swollen and inflamed, like you see here, and those become hypersensitive. So they'll feel everything. Everything hurts basically because those pain fibers can be involved if they're swollen and inflamed. The reality of it is, neuropathy means damaged nerve. A damaged nerve doesn't work good, so it's either going to work too much or too little, but it's not going to be normal. And you can see the difference between nerves and no nerves. You can see a normal one. You can see this nerves, those fine little nerves, come all the way up, go from your brain all the way to the tip of your toe. It's a long way. And when you have neuropathy, you see there's no nerves there. Okay, so you're going to lose function. And some of the functions are for the skin are microcirculation and the metabolic processes. So when we look at a simplified chart of the nerves, we can see the microscopic fibers, the small fibers, and the large fibers. Now, you talked a little bit about your back problem. So the back problem has nothing to do with the microscopic nerves, has nothing to do with the small nerves, has to do with those gigantic, which are really kind of small nerves. So we're going to examine all these nerves to find out what condition these nerves are in. How much function do they have? And you can see there's only a small amount of them that have anything to do with pain. So the first ones, when I talk about neuropathy, neuropathy is a progressive disease. Let's see if I got this one right here. So what do I mean by that? Neuropathy starts in the smallest nerves in the body, right? And it just progresses. So you sort of lose those nerves like the ashes off a cigarette. They're not there. You go like that, they're gone, right? Or I like to use this example here. I'm going to skip that one. Or talk about a melting icicle. And the best one that we use is the dandelion. So you got the large fiber maybe right here, the small fibers, and then the microscopic little hairs that are on the outside. Okay? So neuropathy is a progressive disease. So I basically go like this. Let's see if I can do this right. It's a process, right? It's not an event like a car accident or a heart attack or something. Right. Your happen is for whatever reason these nerves are going away and they're just not being replaced. So you get more and more loss until something happens. So again, the large fibers, the small fibers, and as you lose these things, you lose function, and we're going to talk about that in a while because when you get down to the nub, that's what we have to kind of qualify. Where are you on this process? But neuropathy is a progressive disease. Starts in the longest and the most fragile nerves, which are the microscopic nerves in your toes. Okay? So it kind of melts away. You got it? So you're going to go in, you're going to get the smaller fibers, then you're going to get the large fibers. So all those functions are going to. By the time that nerve damage gets to the ankle, it starts in the next longest and smallest nerves, or nerves in your hands. So of course you didn't report anything, but if you have a severe neuropathy, most likely it's progressed to your hands. So we will, we got something going on there, but people call it a lot of different things. They don't really understand what the nerves do. So let's check all those nerves. The first thing we look at when we check out these nerves, the smallest fibers, is the sweat and the microcirculation. Why is that important? Well, because that's what starts the whole downward spiral. You can have circulation, but you don't have microcirculation. I have a pulse, but I don't have any microcirculation. So we're going to get a puffy, purple, dry, swollen, painful, cracked type of foot, right? That looks purple and puffy, doesn't it? And you can see underneath when you look at it where that's the lowest point, really. And so that's pretty bad. And you can see that's a purple puffy foot, right? So what we talked about, you lose the nerve, you lose the blood, you lose the nerve. This is actually circulation to the nerves. So those are the smallest nerves with the smallest circulation. Guess which ones goes first? And at the same time, why you get that swelling is that when you don't have good function of the vasculature or the blood vessels, the capillaries, not the arteries, You got pulse, you're alive, but it's not getting down to the end of the gutter, basically. Just swishes right by there, you don't get any blood to any of that tissue, okay? When we look at the sensory fibers, or these small and large fibers, they give you some sensations, okay? This is what you can feel. And when the nerves don't work, guess what? Usually you feel bad, and sometimes even pain. So when we're checking these fibers, we look at the patients and we kind of listen to them, and then we check these fibers because patients will report stinging type of pain, like a pricking pain. It's like a burning pain. Sometimes it's like constant burning type of pain. They can have buzzing type of stinging pain, like bugs are eating them. And the reality of it is neuropathy is a progressive disease, so it starts in the tips of the toes, and guess what? The nerve damage will go, and then sometimes the pain will go, up into the hands, and then that's what you get. And you don't always have to have pain. Remember I said the worst ones pass through that whole thing with no pain at all. Right. Some of them get different symptoms like restless leg syndrome, urge to move your legs. And if you think about damaged nerves, this is kind of important for your case, Byron, because, let's say you have bad nerves in your feet. And at the same time, you have nerves that are lost in your feet, right? Mm-hmm. So that you can see that can create a bit of confusion for the brain, because they say Byron can't feel Byron's feet, but something's going on down there. You know what? I got like a bad back. Maybe this pain signals are my back. Mm-hmm. So people have injections and shots and therapies and all sorts of crap, and it's not really from the old man back, because everybody, all men get old man back, Mm-hmm. But maybe it's from the nerve damage, and so that's why we kind of want to check it out, because these nerves are disintegrating, and we have to see at what level. So icicle or disintegrating, because if it keeps going up to the large fibers up in here, you're going to have what? Balance trouble, because you're going to have that numb foot. These are when those large nerves are involved. You're going to have difficulty in navigating. You're going to have to hold on to stuff or use your cane because you can't feel your feet. And then if it progresses more, you're going to have falls. Neuropathy is a true risk for falls. People with bad neuropathy shouldn't even go upstairs and stuff because they don't have the strength. And, falls are accidents. Nobody says, I try to be careful. Well, I try to be careful too, but if you can't feel your feet, you're going to have that problem. It's the leading cause of death. People don't walk. They don't get their cardiovascular health. And, what do they end up doing? As the neuropathy progresses, you're going to lose muscles, and that's what happens. We have to talk about one of the most feared things is neuropathy amputation. it is probably the highest risk factor for amputation is you don't have the metabolic process. You don't run the circulation, right? Microcirculation. But on another level, it works because, if you had nerves, if you have your leg and you cut your leg off, well, you cut everything off, right? But the person can still have pain and buzzing and tingling and burning and cramping, and the leg is not even there. So in your case, you have nerves. If you have neuropathy, you have nerves that aren't there anymore, which is the main thing, right? So you can be like other patients who tell me they have burning pain or they have tingling pain or they have cold feet or something. Yet when I go to examine them, they don't actually feel anything. But it's the damaged parts of their nervous system are affecting the healthy parts, and everything's starting to compensate in the wrong way. That's why we talk about these peripheral problems have central things, because you don't really you have problems with your feet, but if you don't recognize them in your brain, then you're going to have trouble. And the brain is very important, because if you start to lose the foot, as I said, you start to lose those nerves, all the stuff gets jammed into the hips and the back, and you get confused on where everything is. So it's easy. But when your feet don't work, man, they send a lot of information up to your brain. So that's what a lot of problems happen. And the other thing that's pretty bad is nerves never sleep. So you got a broken nerve, and it's sending the wrong signals. It's sending them all the time. That's why the pain's sometimes worse at night or when you're just sitting around, because the nerves are always on, right? You're laying in bed, you can smell the smoke, you can see the light, you're completely asleep, right? Somebody talks to you, you wake up, because the nerves are never asleep. So a bad nerve is sending bad signals all the time, and it's going to let you know about it. So what we're going to do today is do our advanced neural foot analysis, where we're going to check out all the functions of these nerves and give you a score. Okay? The score is, I got a video to put in there, is the severity, which you already saw. So we're going to go by, look at the severity of your words, the severity of your exam, and the percent loss of your nerves based on our other findings. We're also going to observe the foot, because these types of feet that are deformed or have this characteristic are connected with genetic or hereditary neuropathies, right? And we're also going to look at in the mouth, because the tongue, people have cracks and fissures in their tongue, are connected to genetic neuropathies. And what we're actually going to try to do is slow this. If you have neuropathy, it's a progressive disease. So we have to start by slowing this process down, stop it from getting any worse. Well, that's a medical miracle, because I don't see anybody else offering that. But no one's happy with that. So I have to just limp, like I get to limp with just one leg for the rest of my life? Nobody wants that. So really what we're trying to do is put together a program that's going to repair the damage, regrow those nerves and blood vessels, and you regain our sensibility and normal function. One of the ways that we do it is with our light therapy. There's much that's included in the therapy, but I wanted to show you that the light therapy is used right where the problem is. In your toes, where the nerve damage is, in your feet, in your legs, in your back, in your hands, if in fact you do have a problem there. The whole point is we do everything to make the nerves work better. That's our job. So let's see what this is. This is what we're talking about. This is red and infrared light, specific frequencies, specific wavelengths that are allowed to go deep into that tissue, contact those blood vessels. They open up the blood vessels. They reduce the neural inflammation where there's pain. They help the nerves come back to life. This is what helps the nerves get better. Okay, at least one thing that we do. To show you how it works, I think I have a little video here. The light energy passes into the tissue, it opens up the blood vessels, and it helps the nerves come back to life. You can basically see it can go in pretty deeply. And the same thing here, our lights, go on the surface of the skin, they penetrate deep, we're going to open up those actually regrow new blood vessels, and we help those nerves get better. Because guess what? If your nerves get better, the whole nervous system tends to get better, because it's all one nerve, it's all connected. And one of the ways that it works is by having huge increases in the microcirculation. Okay, that little circulation. You can see here is the normal heel beforehand. This is a laser Doppler to see the circulation. Put that pad on for 20 minutes. Right where you put the pad, there's a massive increase in the microcirculation in the surface of the skin. That's vasodilation. Same thing if you do it in the knee. Massive increase. That's like a 400% increase in and it stays. Same thing here. This is a foot before the therapy. What we're gonna do is we're gonna put light therapy on this foot, we're gonna put a heating pad on this foot. Bang. Immediately after the 20 minutes treatment, that foot is just warmer, the blood is getting down there, there's healing. This one, as soon as you take the heating pad off, it starts to cool. This one will last for 4 hours because it's a physiologic change. Okay? So you remember the purple feet that I showed you before? This is her after her first 20-minute therapy. Okay? So we know it works. The idea is how much is going to work for you. We only have to figure it out. You know? Remember that lady with the purple puffy foot? She hadn't worn shoes in 3.5 years. This is after one treatment. Okay? So we know that this is a good therapy. We know our program that we put together with coaching, with the nutrition, with everything that we put in there helps the nerves get better. In fact, 90% of our patients are satisfied with their care in as little as 2 weeks. And one of the things that we're offering our patients at this time is the ProNeuro Home Neuropathy Management Program. This stuff we'll explain to you at the end, but it's a modern approach to neuropathy care. Because what we found after 15 years of doing this is, one, neuropathy is a progressive disease. Every day you're not doing something good to help your nerves, guess what? You're probably losing them. So if we put together a rehab program that you could do at home, you don't have to drive distances. You do the care when you want, not when the doctor wants to work. You can get unlimited visits and do it according to our recommendations. You get better faster, you're going to save money, and you're going to save even in gas will probably pay for the whole freaking thing. So this is what we do. We have success helping these patients because we help the nerves get better. Okay? So that's what I had to say. Okay, so I'm going to have